Pertinent to you, but we're basically going to cover the oral environment. We're going to see a little bit about teeth, about the gingiva, which is obviously the gums. We're going to cover saliva. We're going to go through oral diseases like halitosis. We're going to cover plaque, calculus, gingivitis, periodontitis, and caries. Then I would also like to talk a little bit about additional methods of reducing caries. Toothbrushes we might skip depending on the time, and then dentifrice, that is maybe something more, something that you would enjoy to listen to, the ingredients, the compositions, and other forms of dentifrice. So as we know, teeth are always in style. We don't want to be without them. We need to look after them. We need them to smile, to be social, and to obviously eat. So just a little bit on a background on oral health. Oral diseases affect almost 3.5 billion people. More than 1 in 4 adults in the US have untreated tooth decay. That you're talking about 26%. Gum disease globally affects about 19%. That is more than 1 billion cases. And oral cancer is the 6th most common cancer. So it's 2.8% of all cancers in the US is either oral or throat related. So those numbers are high. So you can see on the left-hand side, it's obviously a mouth full of decay. We have periodontal disease where we have loss of bone. And then, of course, our pathology that might be cancerous or other pathology. So good oral hygiene prevents bad breath, decay and gum disease, necrosis of the nerve, that is when the nerve die and you need to have a root canal treatment. It prevents abscesses and pain, and then in the end, tooth loss. And on the other side, good oral hygiene ensure social acceptance, good aesthetics, self-worth and confidence. It reduces the fear of the dentist and reduce pain and tooth loss. So this is a picture of a healthy teeth and gingiva or gums, and this is what we all strive to give to our patients and strive to look to, so it's all natural and all clean. And then just in comparison, something unhealthy and dirty, which is on the right-hand side, and I think everyone will agree, if you're going to touch this mouth with an instrument, the gums will just bleed. It is just so unhealthy, and that's what we want to stay away from. So the structure of the tooth is obviously much more complicated than just this, but for what we need to know, what we're going to cover is we're going to talk about the enamel, the outer layer of the tooth. We're going to talk about the dentine, which is the inner layer underneath the enamel, and then the root canals, the pulp cavity. So we're going to talk about that, and maybe just make sure that you understand where the root of the tooth is, where the neck of the tooth is, and where the crown, because these are the ones that we are going to talk about, and the names that you're going to hear. So when we look at teeth, we look at the enamel first. The enamel only covers the crown of the tooth. So this is only the part that is visible in the mouth. It is hard, it's translucent white, and it's smooth. It is the hardest tissue in the body. It's even harder than the bone structure of the body. It's not sensitive, and the composition is inorganic substances, calcium and phosphate. And I've put this picture in with this bit of gum recession just to show you that this is the area where the enamel actually stops. Now, this area here, which is the dentine, which I'm going to discuss next, that is normally covered by gum like it should be on this side. But this patient's got some gum recession, and now you can see that the dentine is visible. And as you can see, it is a little bit darker than the enamel, but basically all over where the gum starts, that is where the enamel ends, and what is underneath the gum will be the dentine. So it's underneath the enamel, it forms the bulk of the tooth. It's above and below the gingiva, the gum. It supports the tooth. It is more yellow than the enamel, so a darker color, and it's sensitive and bone-like. So your sensitivity that you get if you have toothache comes from the dentine, and the composition being 20% collagen and 75% calcium phosphate. And just another picture with a little bit more recession, and not only on one tooth, but on more teeth. And I'm sure if you have a look, you can actually see where the enamel stops on each tooth, and then the rest of it is obviously the dentine. So that's more visible, but you can clearly see the difference in color as well. This